Evaluating managerial decision-making. Effective decision-making is crucial for healthcare organizations to achieve their goals and provide quality services to patients. Managerial decision-making involves identifying a problem, generating alternatives, evaluating the alternatives, and selecting the best course of action. However, not all decisions are equally effective, and some may have unintended consequences. Therefore, it is essential for healthcare managers to evaluate their decision-making processes to ensure they are making informed and effective decisions. In this section, we will explore some key factors that healthcare managers should consider when evaluating their decision-making processes. Factors affecting managerial decision-making. Time pressure. Time pressure can significantly impact decision-making in healthcare, as managers may feel pressure to make a quick decision due to time constraints. However, this can lead to suboptimal decisions, as managers may not have had enough time to fully consider all the alternatives or gather all the necessary information. Research has shown that time pressure can lead to errors in healthcare decision-making, including diagnostic errors and errors in medical management. Time pressure can also lead to tunnel vision, where managers may focus on a single solution or course of action without fully considering other options. Therefore, it is important for healthcare managers to manage time pressure effectively to ensure they are making informed and effective decisions. This may involve delegating tasks or responsibilities, prioritizing tasks based on their importance and urgency, and utilizing tools such as decision-making frameworks to ensure a structured and thorough decision-making process. By managing time pressure effectively, healthcare managers can make decisions that benefit their organizations and patients while avoiding the negative consequences of rushing the decision-making process. Information availability. The availability and quality of information can significantly impact the decision-making process. Managers must ensure they have accurate and relevant information to make informed decisions in healthcare. Decision-making often involves complex and dynamic situations that require access to accurate and relevant information. Managers need to ensure that they have a comprehensive understanding of the situation at hand before making a decision. This may involve gathering data from various sources, such as medical records, patient feedback, and financial reports. It is important for managers to carefully evaluate the quality of the information they are using to make decisions. Inaccurate or incomplete information can lead to poor decisions, while relevant and reliable information can support effective decision making. Managers may need to work with other departments or stakeholders to gather the information they need and ensure that the information is up to date and relevant to the decision at hand. Technology can also play a role in ensuring information availability in healthcare decision making. Electronic health records (EHRs) and other digital systems can provide real-time access to patient information, allowing managers to make informed decisions quickly and efficiently. However, it is important to ensure that these systems are secure and that patient confidentiality is maintained. Overall, healthcare managers must ensure they have access to accurate and relevant information to make informed decisions. This requires careful evaluation of the quality of information and effective collaboration with other departments and stakeholders to gather the necessary data. 3. Risk tolerance. This is an important factor that can significantly impact decision-making in healthcare. Managers may have different risk tolerances based on their personal values, past experiences, and organizational culture. Some managers may be more willing to take risks in order to achieve a specific outcome, while others may be risk-averse and prefer to avoid potential negative consequences. It is important for healthcare managers to carefully evaluate their risk tolerance and ensure that it aligns with the goals and values of the organization. This may involve assessing the potential risks and benefits of different courses of action and considering the potential impact on patients, staff, and other stakeholders. Risk management is an important component of healthcare decision-making, as it involves identifying potential risks, evaluating the likelihood and impact of these risks, and developing strategies to mitigate or avoid them. Healthcare managers may need to work with other departments such as legal or compliance to ensure that their decisions align with regulatory requirements and organizational policies. Effective communication is also essential in managing risk in healthcare decision-making. Managers may need to communicate potential risks and their associated mitigation strategies to staff, patients, and other stakeholders in a clear and transparent manner. By carefully evaluating their risk tolerance and implementing effective risk management strategies, healthcare managers can make informed decisions that align with the goals and values of the organization while minimizing potential negative consequences. 4. Organizational culture. It can significantly impact decision-making processes in healthcare. The culture of an organization can influence how decisions are made, who is involved in the decision-making process, and how information is shared and evaluated. In centralized organizations, decisions may be made by a select group of leaders or managers with limited input from other staff members. This can lead to a more top-down decision-making process where decisions are made quickly and efficiently, but may not necessarily reflect the perspectives or experiences of frontline staff. In decentralized organizations, decision-making may be more collaborative with input from a wider range of staff members and stakeholders. This can lead to more inclusive and diverse decision-making, but may also be more time-consuming and complex. It is important for healthcare managers to be aware of their organization's culture and how it impacts decision-making. This may involve assessing the level of centralization or decentralization in decision-making and identifying opportunities to involve a wider range of staff members and stakeholders in the decision-making process. Creating a culture of transparency and open communication can also support effective decision-making in healthcare. This may involve regularly sharing information and updates with staff members and stakeholders, soliciting feedback and input, ensuring that decision-making processes are clear and accessible to all staff members. Overall, organizational culture can significantly impact decision-making process in healthcare. By being aware of their organization's culture and working to promote transparency and collaboration, healthcare managers can support effective and inclusive decision-making that reflects the perspectives and experiences of all staff members and stakeholders. 5. Reflecting on personal biases. Personal biases can significantly impact decision-making in healthcare. Biases are often unconscious and can be shaped by a variety of factors, including personal experiences, beliefs, and values. These biases can influence how healthcare managers perceive and evaluate information and can lead to decisions that are not in the best interest of patients or the organization. To mitigate the impact of personal biases on decision-making, healthcare managers should reflect on their own biases and how they may be influencing their decision-making processes. This may involve seeking feedback from colleagues or other stakeholders to gain different perspectives and being open to considering alternative viewpoints. Additionally, healthcare managers can take steps to ensure that their decision-making processes are objective and evidence-based. This may involve using decision-making frameworks or other tools to guide the decision-making process and carefully evaluating the quality and relevance of information used to make decisions. Effective communication is also essential in mitigating the impact of personal biases on decision-making. Managers may need to communicate their decisions and the rationale behind them, in a clear and transparent manner and be open to feedback and input from other stakeholders. Overall, reflecting on personal biases and taking steps to mitigate their impact is crucial for effective decision-making in healthcare. By being aware of their biases and working to ensure that their decision-making processes are objective and evidence-based, healthcare managers can make decisions that are in the best interest of patients and the organization.